Legionella is a bacteria that occurs in the natural environment. It's in all the drinking water that comes to our homes. It's just under certain conditions that bacteria can grow. Clients are often surprised that you can contract Legionella from drinking water or sucking on ice. It seems counterintuitive to them, but the evidence supports that the majority of cases of hospital-acquired legionellosis in the past couple of decades have been traced back to the potable drinking water. If a person who is susceptible is exposed to the Legionella bacteria by breathing in an aerosol, it can make them very ill. There's two versions of illness. One's called Pontiac fever, and where patients just have flu-like symptoms, and we aren't even aware of it when that occurs. But there's Legionnaires disease is systemic illness, so that means it affects the patient's lungs. They get very severe pneumonia, but it can also affect all their other organs, and it can be a very difficult illness to recover from. Prior to December, there was no national approach to controlling Legionella in the water distribution systems of health facilities. Hospitals, they're considered generally quite a high-risk facility. Plus, the plumbing systems, the water, the way it's distributed through the systems, the temperature is often controlled. So Legionella proliferates or grows very quickly at the temperatures in which the water is delivered to the patients. Now, the water is delivered at that temperature to prevent scalding. However, it's an ideal breeding ground. What we've seen in a lot of these facilities is that people have opted to use treatments which seem very good on the surface in controlling infection, particularly if they've got a medical background, often ultraviolet light or copper silver ionisation. But in the practical sense, we've found those systems often fail, and they fail because they're not deployed appropriately.